Assalamu alaikum warahmatullah. Evaluation of postoperative pain and healing following regenerative endodontics using platelet-rich plasma versus conventional endodontic treatment in necrotic mature mandibular molars with chronic periapical periodontitis. A randomized clinical trial done by Yassmin Ahmed and her group from Cairo University. The aim of this study is to evaluate the post-operative pain as well as the clinical and radiographic healing of necrotic mature permanent mandibular molar teeth with apical periodontitis after platelet-rich plasma revascularization versus conventional endodontic treatment. It's a prospective parallel and randomized clinical trial study, sample size of 28 subjects. They use 28 mandibular permanent first molar with the preapical reducency confirmed clinically and radiographically using the vitality tests and preapical radiographs. CBCT also performed preoperatively to calculate the size of a preapical lesion in both coronal and sagittal views. They use, for the pain assessment, they use a numerical rating scale, and they educate the patient to use the scale 6, 12, and 24 hours and daily up to 5 days. For the endodontic treatment, they divided the patient to a control randomly to a control and intervention group. For the control group, they do a conventional root canal treatment and they operate using a gutta percha, while the intervention group they do a conventional root canal treatment and at the stage of obturation they dry the canal and they induce the bleeding. They induce the bleeding near the apical foramen to a level of a pillow cement to enamel junction, followed by the injection of a freshly prepared platelet-rich plasma into the canals. For the outcome assessment, they ask or they instruct the patient to not eat on that tooth, to record the spontaneous pain, not pain on biting. They prescribe a placebo capsule for the patient, and if the pain is persistent, they allow the patient to take ibuprofen, and they instruct the patient to record the number of tablets and also the degree of pain. Also, they instruct the patient to rate the swelling in case of a flare-up and swelling. They ask the patient to take a painkiller, the ibuprofen. Then they instruct the patient to come the next day to see or they record the swelling rate. CBCT will be performed preoperatively and then at 6 and 12 months postoperatively. For the assessment of a treatment success, they consider successful if it's asymptomatic, not tender to percussion, and has no sinus tract or swelling, and radiographically showed absence or reduction of the preapical reducency. For the results, out of 28 patients met the inclusion criteria, the incidence of a mild pain was less in the revascularization group, with no statistically significant difference between the two groups, except after 12 hours there was a statistically significant difference. For the healing, the incidence of healing of the preapical lesion with no statistically significant difference between the two groups, the percentage reduction of a lesion area at 6 and 12 month follow-up periods, the endodontic group showed a higher percentage reduction with no statistically significant difference between the two groups regarding the mesial root, whilst there was a statistically significant difference between the two groups regarding the distal root at 6 months of follow-up. They concluded at the end that for mature necrotic molar teeth, both regenerative procedures and endodontic treatment resulted in favorable outcomes and a significant reduction in the preapical lesion size. Under the limitation of the present clinical trial, further randomized clinical trials with the standardized techniques and larger sample size are recommended for a stronger level of evidence to assess whether regenerative procedures could be a promising approach for treating mature necrotic molars. And thank you so much for listening.